Good afternoon, teachers, students. This is the first time that we ever have an expert in PBL coming to give you advice and lead the group of PBL in pathophysiology. Because of the time constraints, we have to combine two groups together, and also we invited another group from second year who is doing the pre-PBL to watch you. And in 2 years' time, they will be doing exactly the same thing. So they will gain a better idea what PBL really is. They are doing the level 1 PBL and doing the level 2 PBL. Right? So let me give you a little introduction to our guest, Professor Iain Bruce. You may or may not know that Professor Iain Bruce now is a professor in physiology at Zhejiang University across the Taiwan Strait in Hangzhou, in China. So he was a professor at University of Hong Kong for almost 20 years, and I overlapped with him for about 8 years before I came to work in Taiwan. So we were friends before. So he has been visiting Taiwan National Cheng Kung University over the last 10 years, almost every year, giving us the advice on teaching in English, pre-PL, as well as English writing. So he has already given 3 talks, public talks, the last two weeks, and to be his last days with us on academic matters. So we're really fortunate to have him to be with us, to guide us. I'm learning from him too every time he comes to visit us. He's a very nice person. So what we plan to do for the first part is to ask some of the students, because we are doing a combined PBL, so only ask for my group will be probably 3 students, and they go up and present their PowerPoints from based on the learning issues generated last time. Okay. So, and also another 3 students from Dr. Chai Mei Ling's group. So after each presentation, Dr. Bruce may ask you some question, or ask students to ask questions, and at the end he will give a comment as to how to improve your presentation skills. So then after the PowerPoint presentation session, we are about 10 minutes break, and then we'll meet again for the discussion part on the tutorial 2, the 2 pages of the case. Right? So you have any question, you can raise your hands. And the session will be videotaped by a few cameras at different parts of this lecture theater. Then it will be made into a DVD. So if you like, you can have a copy of that, and it will be put on the internet for future reference. So for education purposes. Right. Okay. So is there any questions? So you will have to go up. Don't be nervous. So after a while you get used to it. It's no big deal. So all right. So who would like to volunteer to be the first to talk? If not, I have to find one. Name one. Okay. So Shelley. You can stand in front of here or stand on the deck.
Same topic, so
okay.
I need to introduce first, so I can tell them why we need to measure it.
Okay. You can go through the slides and then concentrate on your part. Can you?
No.
Okay. If that is the case, you just concentrate on your part. Can you do that?
I just
Why is it?
presenting my part.
Wedge pressure. So you think it would be better for the 3 of you to do the presentation?
Yes.
Okay. All right. So if that is the case, then I have to ask you to do it quickly.
Okay.
Right? Okay. So who be the first one to talk? Okay. So, sorry. So because I understand that you are doing the PowerPoint in a group, so I cannot ask one of you to present her part without the others presenting. So I have to ask you to present it briefly, right? Briefly, concisely, give the important point, right? So for your group, it will be 3 of you. So you have to come out and do the presentation, but briefly. Don't. So the first one will be Sally. Sally. So do it briefly. Okay. Followed by Lydian and then Shelley. Please tell us your learning issue first.
Okay. Hi everyone, I'm Sally, and Cheryl, Lydian, and I were going to present about wage pressure. Okay. First of all, I'm going to present about what is wage pressure. Wage pressure, the definition of wage pressure is the intravascular pressure reading obtained when a fine catheter is advanced until it completely occludes a small blood vessel or is sealed in place by implantation of a small cuff. So, briefly, it means that we put a catheter into our vessels and then inflate it. And we can use this device to measure the pressure in the blood vessel. And the most this technique is most commonly used to measure pulmonary capillary wedge pressure, PCWP in short. And by measuring PCWP, we will be able to know the left atrial pressure and left ventricular and diastolic pressure. And because Lillian and Sherry, they will talk about these in more detail later, so I will not talk about it right now. Okay, and this is a brief picture about the circulation of our body. This part is the right part of our heart, and this is the left part. So basically, we put the catheter into the right heart through the atrium, and then to the ventricle, and then to the pulmonary artery. You can see it; it's right here. And we will inflate the balloon right here, and we will be able to measure like the pressure in the pulmonary artery, or here, or the left atrial pressure, or the left ventricular and diastolic pressure. And this could be used as an index for left ventricular and diastolic volume. Okay, so Lydian will talk about it in more detail.
So I'm going to talk about how is wage pressure measured. And first we insert this balloon-tipped multi-lumen catheter. It's called Swan-Ganz catheter, and there's supposed to be someone else introducing this catheter, so I'm not going to talk about it right now. And we insert this catheter into a peripheral vein. So the catheter in the peripheral vein would be advanced into, you can see in the picture, it can be advanced into the right atrium and then the right ventricle, and then the pulmonary artery, and at last it would be in a branch of the pulmonary artery as the balloon you see in the picture. So this thing, it has 2 ports. One is at the tip distal to the balloon, and one is at the tip proximal to the balloon. And both parts,
It's a learning issue for you. And that's our reference. Thank you.